This is the third video on the irritable bowel syndrome and will discuss treatment. Let's now talk about the management of IBS. There is no cure for IBS, but lifestyle changes and avoiding foods that trigger IBS can help. There is no one fit treatment for all patients. Rather, the treatment is tailor-made for the individual. It is a matter of observing what food triggers the symptoms and to avoid it if it worsens the symptoms. By trial and error, the patient will discover a diet that they are comfortable with. Certain lifestyle changes might help. Avoid coffee, alcohol, and sugary drinks. Avoid coffee as it can stimulate the intestines. Stop dairy products. Stopping all dairy products for a while and observe whether symptoms improve. Many people suffer from lactose intolerance. Lactose is found in milk, butter, cheese, and yogurt. Trying a FODMAP diet that is low in FODMAP type of foods might help. FODMAP refers to a group of carbohydrates that are not well absorbed in the small intestine and are rapidly fermented by bacteria in the large intestine, producing gas. A majority of IBS patients seem to have intolerance to FODMAP. This is a picture of foods that are low in FODMAP. The next video will discuss FODMAP. Keep a food diary. Keep a food diary and observe whether there is any link between certain foods and symptoms. Try to take small frequent meals. Large meals may cause cramping and diarrhea in some patients. A low-fat diet might help as fat greatly stimulates colon contractions following a meal. Eat around the same time every day, as eating causes contractions of the colon and an urge to open bowels within 30 to 60 minutes after a meal. In IBS, this urge may come sooner and trigger stomach cramps and diarrhea. Trying to eat slowly might also help. One tends to swallow more air when eating is done in a hurry. This can make the bloating worse. Avoid delaying the urge to have a bowel movement. Also avoid straining during a bowel movement. Try to relax and take your time. Gradually increase your fiber intake. This helps both diarrhea and constipation but may make bloating worse. There are two types of fiber, soluble and insoluble. Between the two fibers, the soluble fiber is better. It dissolves in water, forming a gel. Soluble fiber causes less gas and bloating. The recommended total amount of fiber is around 25 to 30 grams per day. Soluble fiber is found in oats, barley, dried beans, citrus fruits, and apples. An excellent source of soluble fiber is psyllium. Psyllium also goes by the name isakhula. The general advice is to start on psyllium at a low dose and increase gradually at no more than 5 grams per week. Generally, fiber improves diarrhea and constipation, but not stomach pain. One has to be careful with insoluble fiber as it may worsen IBS symptoms, especially bloating. This is because bacteria in the colon can break down insoluble fiber, producing gas, which may make the bloating worse. Often, many foods have a combination of soluble and insoluble fiber. So, it is better to avoid insoluble fiber. Try your best to have good sleep, as poor sleep may trigger IBS. Regular exercises may also help, as it may improve the bowel movements and may also help to reduce stress. Your doctor may try medications if you do not respond to dietary and lifestyle changes. Medications are usually given to treat the symptoms. Remember, there is no cure for IBS. Fortunately, most of the time, patients feel better after the medicines. Let's discuss what are the kinds of medicines that a doctor might use. Antidiarrheal drugs like Imodium and Lomotil. These drugs slow down the movement of the intestines. They help with loose frequent stools and are used in patients with diarrhea. Antispasmodic medicines like Mebaverine and Alverine. These medicines relax the muscles of the intestine and reduce intestine spasm and pain. Constipation can be treated by several means. Firstly, by increasing bulk fiber in the diet or taking a supplement like psyllium. Also, osmotic laxatives may help, an example being PEG or polyethylene glycol. It works by causing water to be retained within the stools. This increases the number of bowel movements and softens the stools so it is easier to pass it. Another medicine that can be used for constipation is crucalopride that can be tried for patients who do not respond to fiber. Antidepressants in low doses may help relieve pain and diarrhea in some patients. These include amitriptyline and nortriptyline. They are used in lower doses than the dose used for depression. Another group of antidepressants called selective serotonin reuptake inhibitors or SSRI may also help. Anti-anxiety drugs help reduce anxiety that can worsen IBS symptoms. So some of the drugs that are used include lorazepam and clonazepam, and has to be given under the strict supervision of a doctor. An antibiotic called rifaximin improves symptoms but is only available in some countries. This antibiotic is not absorbed into the body, so the side effects are less. So what is the role of probiotics? Probiotics that contain healthy bacteria are as yet unproven. However, patients can try it for a month and see whether it works. IBS is not a psychological disorder. However, some patients realize that stress and anxiety make the symptoms worse. In such cases, psychotherapy can help. This could include formal counseling. A counselor can help to modify and change response to stress and can provide significant and long-lasting reduction in symptoms. Cognitive behavior therapy. It helps people develop strategies for reacting differently to the condition through positive attitudes. Biofeedback. Electrical sensors help the patients receive information, feedback on their body's function. The feedback helps them to focus on making subtle changes such as relaxing certain muscles to ease symptoms. Other forms of psychotherapy that might help include mindfulness. This is a stress-releasing technique that teaches one to focus on the present. Relaxation exercises. These exercises helps the patient relax muscles in their body one by one. Finally, there's hypnotherapy. It helps to alter the way the unconscious mind responds to physical symptoms. Most people with IBS can lead a normal life. IBS does not lead to serious complications and will not affect one's lifespan. The biggest problem is it affects one's quality of life, and many patients will have ups and downs and symptoms for the rest of their lives. Most patients learn how to live with IBS with diet and lifestyle modifications. Statistics show that some IBS patients get better every year.